Here's the video you've all been waiting for, the removal of the corn snake's retained egg. So how did we get here? Well, this corn snake had been egg-bound for quite some time, about 6 months. I took her in and immediately started getting her care. Here we are taking x-rays of her to confirm how many eggs were left. Thankfully, it was just one. We then used an ultrasound to assess it further. It appeared to have solidified and become inspissated. She was dehydrated and thin when she came to us, so we got her some fluids with a vitamin. Calcium and oxytocin rarely work in snakes, but it was worth a shot. But not surprisingly though, we did not see the results we wanted. We were not able to access the egg through her vent, so off to surgery she went. While she was becoming sedated after her injections, we decided to take some straighter x-rays. Be sure to see my other video for more information on x-ray interpretation. Here she is intubated with a tiny little catheter and all hooked up to her monitoring. I gave her a local block, which numbs the skin over where my incision will be. Once she was adequately under, it was time to begin. When making an incision through snakeskin, it's important to try and go between the scales, almost in a tiny zigzag. I used this device to keep the skin parted while making deeper incisions. For this part, my coworker, Dr. Champagne, lent an extra hand. If you haven't checked out her page yet, she has some great surgery videos as well. Finally, we could visualize the egg. We wanted to get the egg out of as tiny of an incision as possible. With a little manipulation, we were able to angle it and pop it right out. One good clump of egg came out, but because it had become rotten, there were some chunks left behind that we had to go after. Once all of those were removed and she was flushed out real good with sterile saline, it was time to suture her closed. First we sutured the oviduct, then the body wall, and lastly, the skin. One really important thing to know about suturing reptile skin is that you have to do an everting pattern, or a pattern that sort of rolls the skin outward where it meets. Due to the scales, the skin normally tries to roll in on itself, which can prevent it from healing appropriately. In this case, I use a horizontal mattress suture. Finally, we were finished. Here's most of the egg after it was removed. I bet you want to see me cut into it, right? Well, I'm not going to leave you empty-handed. Here's what the egg looks like on the inside. Sometimes you may see people try to use a needle to deflate the egg and make them easier to pass, but there was no way this was going to happen with an egg this solid. And here she is feeling much better. Although she hadn't been eating well before, she gobbled up her first few meals. I fed her small meals to begin with because I didn't want her stretching out her stitches, but she was gobbling down mice in no time. Once she was recovered, she found the perfect home and was adopted by one of my technicians. I'm so happy we were able to give her a new lease on life.